It amazes me that we have doctors here that you can walk up to and speak to face, who travel not only the region, but the country and the world, that are nationally and internationally known. They are such a tremendous resource, and they're willing to give their time to help raise awareness. That is just a fabulous opportunity.
We want as many people as possible to be aware about what their risks are for stroke and what should they do if they have symptoms of stroke and how to recognize them. We want their family to know that. We make it on a regular basis every year to try to increase the awareness and make sure that the whole community knows what to do about stroke, because stroke does not spare anyone.
We are so blessed to have the medical center here that has a 24-hour stroke team on staff. And people need to be aware of that before it happens, because during an event, as you're not thinking logically, that information needs to be embedded in our heads.
It can happen at any age. Even kids have a stroke. Young adults have strokes. Teenagers may have a stroke. And we want everyone to be aware when it happens, because the time is precious. Call 911 and get to the emergency room as soon as possible, particularly to a place that is specialized in stroke and can deliver the care that you need.
To be able to direct them to a facility that's going to be able to care for them in an immediate and appropriate manner means that our outcomes are better. Our life after having survived a stroke is much better. So that we are able to walk and talk and raise our families and go back to work. Those things are so important to me.
The key symptoms actually having a sudden onset of weakness or numbness on one side or the other, having a sudden loss of vision on one side or the other, having a sudden loss of the ability to speak or understand speech or have slurred speech, or having the sudden onset of loss of balance. And finally, having had the worst headache in your life.
My role here today is to let people know that after surviving a stroke, that there is a group of survivors who get together here and support each other in being survivors and not victims.